Hello and welcome to the AHA Team Trainings video on TeamSTEPPS for the COVID-19 crisis. This video will feature TeamSTEPPS tools focusing on closed-loop communication that will serve to optimize team functioning, especially needed during this time of the COVID-19 pandemic. But before we begin, I wanted to introduce myself. My name is Laura Goliath, and I am a TeamSTEPPS Master Trainer, Certified Family Nurse Practitioner, and Associate Professor at Ursuline College, the Breen School of Nursing in Cleveland, Ohio. In this video, we will briefly provide education on the TeamSTEPPS tool, Closed Loop Communication, followed by how it can best be applied during this critical time in healthcare. But first, we need to have a shared mental model on what TeamSTEPPS is and what it can do to enhance team effectiveness. TeamSTEPPS, as known as Team Strategies and Tools to Enhance Performance and Patient Safety, is an evidence-based set of tools designed specifically to help healthcare professionals improve patient safety and quality through effective communication and teamwork skills. AHA Team Training is the leader in providing TeamSTEPPS education and support to the field. TeamSTEPPS is vital for helping healthcare teams provide an effective response to the COVID-19 pandemic. This is a time of much uncertainty about the course of a very unpredictable and harmful virus. But what we do know is that our greatest strength and resiliency lies in our team response. Strategy matters, and what we do have are evidence-based strategies to improve team communication and performance, enhance safety, strengthen and sustain our teams on the front lines, and that is TeamSTEPPS. Communicating is simply defined as the process of exchanging information between individuals, departments, or organizations. Communication is an integral component in providing safe, high-quality patient care. Communicating effectively, especially during this time of crisis and stress, where even a greater number of crucial communications are taking place, is a goal shared by all. But how do we do that? The tools we are featuring fall under communication in the TeamSTEPPS curriculum. Communication interfaces directly with the other components of the TeamSTEPPS framework. It is the lifeline of a well-functioning team and serves as a coordinating mechanism for teamwork. Effective communication skills are vital for patient safety and are the mode by which TeamSTEPPS tools and strategies are executed. In other words, ineffective or insufficient communication can cause critical delays or may result in sending the wrong message, which can negatively impact patient or staff safety. And when communicating in rapidly changing situations like the COVID-19 pandemic, where information must be disseminated quickly and accurately, structured communication. The need for effective communication strategies cannot be understated and lies at the heart of successful teams. According to the Joint Commission, poor communication was found to be the root cause of 79% of all sentinel events. Additionally, they found that gaps continue to exist in communication, especially during handoffs, thus increasing patient safety risk. The Joint Commission determined that a common gap in communication most often occurred when there was misalignment between the sender and the receiver when communicating. In other words, misalignment occurred when the receiver got information that was inaccurate, incomplete, non-timely, misinterpreted, or otherwise not what was needed. So the potential for harm was compounded by the high frequency of crucial communications that take place in healthcare on a daily basis, especially in times of high stress, such as now in the COVID-19 pandemic. Remember, the best defense is a good offense, and that is working to fight the COVID-19 pandemic in effective teams that communicate well. So what are the standards of effective communication? What makes communication effective? Well, when sharing information with the team, which can include other providers, patients, family members. Communication must meet 4 standards to be effective. This is what the evidence shows. Effective closed-loop communication must be, number 1, complete, so determining the critical information that needs to be communicated, communicating all relevant information while avoiding unnecessary delays that may lead to confusion, and leaving enough time for patient or colleague questions and answering those questions completely. Communication must be, number 2, clear, using information that is plainly understood, such as in layman's terminology with patients and their families, and also common and standard terminology when communicating with members of the team. Communication should be, number 3, brief. Being as concise and succinct as possible will avoid additional delays. And lastly, number 4, effective communication should be timely. Being dependable about offering and requesting information and avoiding delays in relaying information that could compromise a patient's situation is crucial. Noting times of observations and interventions in the patient's record, updating patients and families frequently, verifying authenticity, which requires checking that the information received was the intended message of the sender, and validating or acknowledging information. So effective communication should be complete, clear, brief, and timely. Now let's talk about some specific TeamSTEPPS strategies for communicating effectively. A call-out is a strategy that is used to communicate important or critical information in a complete, clear, brief, and timely manner. The call-out method informs all team members at the same time, helps team members to anticipate the next steps, and directs responsibility to a specific team member to carry out the task. Let's look at an example of a call-out. An example of an effective call-out can be seen on the right. So a nurse, 2 residents, Amy and Bill, and a patient care assistant, Jim, rush to enter a hospital room to answer a call light. The patient's complaining of chest pain, only to find that they find the patient pale and unresponsive on the floor. So the nurse performs the call-out. The nurse says, "There is no pulse. Amy, call Cold Blue. Bill, start compressions. Jim, get the crash cart." So in an effective call-out, there is no room for doubt or personal interpretation. Few words are used, but they are meaningful and clear. A call-out is an example of a closed-loop method of communication. It is a complete circular loop with a beginning, middle, and an end. Another closed-loop communication method is using the Checkback strategy. This strategy helps team members verify and validate the information exchanged. Information provided in closed-loop format is not only received more quickly and accurately, but implementation and follow-up actions are faster as well. Checkback involves the sender initiating a message, the receiver accepting the message, and this includes the opportunity to ask any questions and to confirm what was communicated. And then lastly, the sender verifies that message that it was accurately received. Although the sender opens and closes the loop, both the sender and receiver have responsibility in effective checkbacks. The sender opens the communication by initially sending the message. The receiver confirms receiving the communication and restates the message. Then the sender closes the loop by communicating to the receiver if it was understood correctly or not. So let's look at an example of Checkback. So a physician is providing verbal orders via phone to an RN for a patient that he or she suspects of having a DVT, a deep venous thrombosis. The physician states, Mr. Johnson, date of birth 2/20/59 in room 340, may have a DVT in his right calf. Let's get a stat venous duplex ultrasound of the right leg and D-dimer. Discontinue the compression stockings and place on bed rest. The nurse, and it is much recommended that this is written down, but the nurse confirms, let me confirm. she or he states, you want a stat venous duplex ultrasound of the right leg and D-dimer lab test, discontinue the compression stockings and place the patient on bed rest. This order is for Mr. Johnson, date of birth 2/20/59 in room 340. The physician, as being the sender, simply states correct. So you can see that both the sender and the receiver have important roles in Checkback. In a recent quick safety report, the Joint Commission reported that when used effectively, closed-loop communication could substantially reduce patient harm. This was seen specifically in mitigating diagnostic error, one of the most common catastrophic errors occurring in healthcare today. One example of diagnostic error cited in the informational report involved transmitting abnormal outpatient results in the electronic health record without knowing if the message was received and understood by the patient, thus preventing actual follow-up to an abnormal result. This created a dangerously flawed, open-looped situation. Closed-loop communication, when every test result is sent, received, acknowledged, and acted upon without failure, is paramount to reducing diagnostic error. When members of the healthcare team use closed-loop communication, their message or task is completely understood. So let's look at a quick call-out communication example in a COVID-19 response. An emergency preparedness team, EPT, was formed recently in a large metropolitan hospital here in Cleveland, working to adapt response plans and checklists for the COVID-19 pandemic. Included in these plans was the addition of a large surge tent equipped with COVID-ready beds, supplies, and ventilators to handle the overflow of COVID patients from the regular units needing intensive care treatment. A system-wide code for admitting a patient from the regular unit to the surge tent was established as Code C, which, when called, deployed the EPT rapidly to the room of the patient who needed the additional COVID measures, such as mechanical ventilation. The EPT team reported to the room and then would transfer that patient to the surge tent. So a little bit about the background of this particular call-out example. The resident finds that a COVID-19 patient's respiratory status is deteriorating, but knows that the ICU has no available beds. Respirations are labored at 36, heart rate is 140, blood pressure is 88/50 and declining. The patient's desatting with an O2 sat rate of 85%. Patient's diaphoretic and increasingly lethargic. So the resident on the intercom, code C, room 505 main building, the resident repeats this 3 times. This is an actual call-out method being used presently in one of our regional hospital systems, and it is working. The call-out is clear and concise. There is no room for doubt. The call-out immediately activates the EPT to the room of the patient with all necessary PPE and transfer equipment. This successful execution of the system depended on several factors in place, grounded in closed-loop communication: a shared mental model, a system-wide code, the formation of an EPT, the development of a surge tent, COVID checklists for bedside assessment, and effective call-out. Let's look at another example of closed-loop communication, the Checkback communication in a COVID-19 response. This is another example being used at one of our large regional hospitals here in the Cleveland area. At the time, it was well established throughout the state, throughout the nation, there was a critical shortage of N95 respirator masks, which are essential for our frontline healthcare teams to use with our active and symptomatic COVID patients. All FDA-cleared N95 respirator masks are labeled as single-use, disposable devices. However, in response to the critical shortage of these masks, the FDA has recently lifted restrictions so that N95 respirator masks can now be safely sterilized for use again by sanctioned facilities. The chief hospital intensivist calls an emergency COVID-19 response meeting for the MICU manager to notify them of this change and when and where the re-sterilized N95 respirator masks would be available. An example of checkback communication in a COVID-19 response would be the chief intensivist states, effective immediately until further notice, re-sterilized N95 respirator masks will be available from MICU to pick up every Monday between 0600 0700 in Central Service Supply. The MICU manager restates, just to confirm, re-sterilized N95 respirator masks will be available for our MICU to pick up every Monday between 0600 0700. We pick the N95 respirator masks up in Central Service Supply. Chief Intensivist, that is correct. This is an example of the importance of using the checkback communication strategy. It closes the loop from sender to receiver, back to sender again, where the sender in this case confirms the receipt of a correct message. The message is clear and complete, which is crucial to explain new protocol, to replenish the unit with PPE that is vital for keeping both healthcare staff and patients safe. Closed loop communication is a way of closing the deal to ensure that everyone is on the same page, and that's known as sharing the same mental model. And the team member knows not only what to do, but knows when and where to do it. So in summary, as we look at coaching in the moment, creating a closed-loop culture during COVID-19, closed-loop communication is essential during times of stress and strain, where our communications must be crystal clear. This is true every day in healthcare, but especially pertinent when life or death is at stake during a time of a pandemic such as COVID-19, where protocols and patients' conditions often change rapidly and must be communicated clearly, concisely, and in a timely manner, offering no room for error. During this time, we know that there are many things we have no control over in the pathway of a deadly virus, but where we do have control and can make a difference is in creating the best communication loops possible with our frontline team for complete and timely task completion to keep everyone as safe as possible, and that is a closed loop system. So some tips in coaching in the moment, creating a closed loop culture in your organizations include, number one, establish the urgency and importance of using closed loop communication. So make sure your team is aware of the evidence behind closed loop communication. When used, it keeps patients and staff safer. Pull up the AHA team training resources or these webinars. They may serve to help and assist you. Number two, define closed loop communication to your team with specific examples. So have a communications briefing with your team to discuss closed loop communication. Give them relatable examples of good call-outs and checkbacks. Huddle briefly mid-shift to assess and troubleshoot. And in your shift debrief, talk about the effectiveness of closed loop communication that day or night. Number three, model closed loop communication in team interactions. When talking policy or needed actions, use closed loop communication. Number four, communicate clearly and concisely in a closed loop format with a beginning, middle, and an end. Number five, be as specific as possible when communicating, and communicating all and only necessary information such as expectations, procedures, room numbers, timelines, deadlines, follow-up. Don't get caught in the weeds, and I've been known to do that as well. Keep it on point. Number six, allow time and opportunity for questions, concerns, and clarifications. Very important. Make sure the receiver has no questions, and this includes creating a culture where colleagues are not hesitant or afraid to ask a question, and being situationally aware of your colleagues' response to the information they are being given in the way of nonverbal and looking at body language, etc. Do they look hesitant or unsure about what you are saying or asking? This is an important aspect in closing the loop, making direct eye contact with the receiver. Number 7, create a specific follow-up plan when needed. So feedback and quality improvement is an important part of closing the loop. Establish a follow-up plan to make sure appropriate action was taken and there are no issues or concerns that came up with the implementation. Circle back for status updates. And number 8, provide a hard copy of the plan in closed loop format to the receiver when possible. Many people need visuals and reminders of policy changes, and new information. So placing clear, concise information with the date up in common areas such as break rooms, unit desks, and clean supply rooms is very effective and ensures everyone is on the same page. In the case of our new policy concerning N95 respirator masks, a clear, concise statement that reads, re-sterilized N95 respirator masks must be picked up in central service supply every Monday between 6 and 7 a.m. Written in bold letters and dated is very effective to place in common areas. So lastly, and very importantly, to all those fearlessly fighting the battle against COVID-19 on the front lines, and to all those supporting them, know that you're making a difference each and every day. Thank you for all you do. For more evidence-based TeamSTEPPS resources to promote safety, please see the AHA Team Training Resources webpage at this link below. Thank you for joining us today. The AHA Team Training is here to support you during the COVID-19 crisis and for all your future patient safety and quality improvement needs. Feel free to get in touch with the team should you need any additional assistance or resources. Stay safe by using closed-loop communication and all the other effective TeamSTEPPS and team training resources offered by the AHA. Thank you.